Hello, my friends, both old and new. This is going to be a new topic. This is going to be the topic of the TURP surgery process and recovery. And the reason I'm doing this video is because of all of the guys out there, the tens of thousands of messages I've read about all of the different treatments, whether it was Urolift or aquablation or green light therapy, red light therapy. In the end, my surgery, December the 3rd, was a successful TURP operation, and I'm recording this. I'm going to catch up a little bit. This is December the 7th, but I'm going to start from December the 3rd because that's my picture just going into the operating room. So I'm not going to be doing videos where I'm talking directly into the camera right away because I have some other recoveries that I'm doing, but I want to talk about the TURP surgery. And this was in Broward County. I don't know. I don't know that I should name the doctors. I'm a little hoarse actually from the anesthesia, but I want to give a recommendation. If anybody is trying to decide where they're going to do their surgery, mine was done in Broward Health. Most Floridians know it as Broward General Hospital. And the treatment I received was absolutely, in my opinion, VIP. From the time this began, had 112, 118 centimeters size prostate, complete urinary retention, sent me to the emergency room at Holy Cross back in July, and I've had a catheter since July the 19th. And you can imagine it's almost December 19th. That's 5 months. So I'm going to tell people that what I've learned, hopefully this will help, even if it helps one person or if it clears up for one person. I'm going to start a whole series of videos about my recovery. It is 4 days later. I'm a little hoarse from the anesthesia tube that was down my throat. Hopefully that's going to go away pretty soon. But it's 5 days from recovery. I had to go home with a catheter because there was a blood clot that blocked the bladder entrance. And I had a lot of blood up until this morning. So I'm hopeful that the catheter will be removed Monday. I've had nothing but infections from the time the catheter was put in. And 5 months is obviously a really long time. It was a Foley, so I wasn't self-catheterizing. But I did wind up at the emergency room 3 times to get the catheters replaced because they clogged either from blood clots or bacteria, or they just closed. So if there's interest in the TURP surgery and my recovery, I'm 64 years old, 5'11", 200 pounds. I had never been in the hospital before, and I did have symptoms, which I thought I was just going to have to live with as an aging man in America. But as it turns out, the urinary retention sent me directly to the ER, and I was given 0 options. So here's a couple of things that I want to just express on this first video, and that's thank you, from all the people that comment on videos about benign BPH. Your comments and life stories were invaluable as I went forward. My process was simple. I went first for the digital rectal exam, where it was estimated I had a 50 centimeter prostate. Then I was sent for the transrectal sonogram. There it said I had a 80 sonogram prostate. And then I took my first PSA test that I'm aware of, and it was 15. So since it was done right after I had the DRE, he decided to give me 2 weeks for my body to calm down and take another test, and I think it was 3 weeks. could have been 4. And I went to the vitamin store and I started taking all the lycopene and the saw palmetto and the green tea and all of the remedies that are supposed to lower PSA and help shrink prostate. Absolutely none of it helped. My PSA went to 17 and a half, and that sent me to an MRI. Now the doctors are worried about cancer, and at the age of 64, I have to admit they got me a little nervous. So I went for the MRI. The MRI showed nothing abnormal, but it showed me at 112 or 120, I don't remember at the moment, I think it was 112 centimeter prostate. So as you can see, each exam produced a larger number. Regardless, the decision was made to do the TURP so they could do pathology and get as much tissue as possible. And thankfully for me, they saw no lesions, they saw no tumors, and as far as I know, there's no fear of cancer. So that's today. There'll be much more recovery video. I'm going to just start off with this video. Hopefully there's interest. I personally had a lot of interest. I probably looked at every single video about every single procedure, and I was 100% absolutely sure that I was going to have aquablation. And I went to the urologist and I said, I want to do the aquablation, and he said good luck, because he had 2 clients with the top Blue Cross Blue Shield insurance, both deny aquablation. So I didn't expect to get it either. I agreed to the TURP, and as of right now, I'm glad I did. If there's any comments, I will respond to every single comment. And if anybody wants to text me directly, my number is 209-783-8336, 209-783-8336, and I will respond to anybody's messages. I'm very thankful for the people that did these before me, and I think that it's only right that I do the same. Okay, thanks y'all, and best of luck.